So, what in the world is prolotherapy, and were we really shooting sugar into people to help them with orthopedic injuries? You'll find out today. I'm Dr. John Tait. I'm a non surgical orthopedic doc. And yeah, believe it or not, back in 1937, they weren't using table sugar like this packet in my hand. They were using something more like I have here, which is, a medical standardized version of sugar called dextrose. And even before that, using different compounds. But the concept was this. There was a doc by the name of George Hackett, and he had a patient with a painful TMJ joint problem. So a little joint in the side of your jaw that pivots your jaw up and down. It was very painful for that patient, and they were trying to figure out what to do with it. Now, 1937, that was actually before steroids came on the scene in 1948. So later, another doc, the development of corticosteroids, started using that in a rheumatoid arthritis patient. But if we go back almost a decade prior, there was this other doc thinking through, if somebody has a painful joint, how do we help them? We take for granted nowadays that we have medications in every store in America. You can walk in and you can buy ibuprofen, Tylenol, different pain relievers. You can get topicals like Voltaren gel or arnica, and you can slather that on a joint, and maybe that will help with pain. But all the way back then, they didn't have those tools. They didn't have those remedies to use. So he started to look through and understand this mechanism of how the body actually heals itself following an injury. So if we walk through that, if you get injured, the body gets inflamed. We've all felt that. You've tweaked your shoulder, your knee. What do you feel? An ache and a throb. And what is going on there is that we break tissue. So we tear tissue, we release from the capillaries of very microscopic blood vessels, some cells called platelets. Platelets have a mechanism we've all seen in action when we get injured. They form a clot so that we can form a scab so that a cut can heal. But if we're doing that under the surface, we don't see any of that action. But the platelets then release growth factors, and the growth factors stimulate healing. So again, injury, inflammation, you feel the ache and the throb, and then what it's sequencing is actual healing and repair, by which cells are attracted to the area. They clean up the mess from the injured tissue, and they start to systematically repair that tissue. And when we walk that through 2 to 4 to 6 weeks, and it really takes about 6 weeks to get healing in tissue, and that's why you see common injury reports, they say somebody is out 4 to 6 weeks. So he thought, well, this is an interesting mechanism. What if I take some sugar and dilute it down into a solution and make it injectable? And he thought, if I can instigate some inflammation, okay, and that same mechanism, inflammation following an injury, should stimulate healing. So he took this solution, he convinced the patient, to say, hey, I'm going to inject some sugar into the side of your face, and maybe we can heal this TMJ, this joint pain you have. And the patient was apparently game for it, and off they went. So as they watched the result of this over the next 2 to 4 weeks, the patient came back, and lo and behold, they had far less pain. So they had induced this change in the patient, or really instigated this natural mechanism that the body uses to heal. And he did this by, precisely injecting it where it needed to be. So we're causing mass inflammation in the body, like if we go on a sugar binge, guzzling Mountain Dew and Sour Patch Kids. But if we put this precisely into the joint, or I'm using it nowadays to trigger joints anywhere from a knuckle to elbow tendon. And again, 1937, it is now 2024 last time I checked, and we still use this tool now and again. So it's really interesting, a very, very, very old tool. This is kind of the introduction to regenerative medicine as we know it now. But the very first concept of this was really stimulated by this guy named George Hackett, that literally stimulated with a sugar solution this healing mechanism. So out of that became kind of this evolution of thinking, and docs like him to start thinking about treating things in the body much differently. And as this evolved kind of into the 1940s and 50s, prolotherapy was much more widespread and being used. And then onto the scene, as I mentioned before, about a decade after him doing this with the TMJ, well, steroids come on the scene. Okay, so steroids now start to be the easier mechanism and somewhat more readily acceptable in the medical establishment and even with patients to say, hey, instead of inducing inflammation and triggering actually a little bit more discomfort to trigger healing, what if we just took steroids and just bathe this thing instead and shut off the pain? And if you're being presented those two options, you would say, yeah, why would I stimulate inflammation to then, wait 2 to 4 weeks to feel better? So when that proposition was put in front of people, they said, of course, steroid sounds like a better thing to me. Just shoot steroid in that joint, make the pain go away. And so if you've seen some of my other content, I've talked through the dangers of corticosteroids, or what a lot of patients refer to as just cortisone. Cortisone is actually detrimental to these tissues. If we inject it at dose, it actually weakens tissue. Okay, so if we're putting corticosteroid in a joint repeatedly, we can weaken the joint cartilage, we can weaken the structures around that joint, like ligament and tendon. So my role and job when I look at taking care of an injury is, can we do this in a way that's the least harmful to the body? And putting high dose steroids in there doesn't really hit the mark for me. So now, as things have evolved, we got a lot of other tools. Now, definitely dig into those on other videos, but I wanted to go way back in time here to talk about the kind of the evolution, really the incident that stimulated and really launched what we now know as regenerative medicine. So a little brief history for you today. So if you like stuff like this, you want me to do a little history lessons on medicine, click the like button, subscribe to the channel, and we'll do other fun stuff like this. But in other videos, I'm going to walk you through some of the now modernized versions of prolotherapy. And if you have any questions on this, drop them in the comments below. Yeah. And by the way, if you need help or if you're looking for a different alternative solution than conventional pain management or corticosteroid shots, then look in the show notes below the video here and you'll see a link that takes you over to a page on my website where you can fill out a little bit of information about you, and somebody on my team will reach out to you to see if we can help you in any way if you're a great match for the things we do here at Origen.